The dangers and costs of mandatory overtime have been well documented in a number of scientific studies published in the last decade, which included findings that nurses working mandatory overtime are 3 times more likely to make costly medical errors, and that overtime for nurses was associated with an increased risk of catheter-related urinary tract infections, bed sores, and others, both preventable and medical complications. In 2002, the Institute of Medicine issued a report linking mandatory overtime and the understaffing of nurses to thousands of patient deaths each year and called out for an all-out prohibition of this practice. 10 years later, our state has heeded this call, and it has never been more necessary, as our hospitals in recent years have slashed RN staffing levels and implemented a de facto hiring freeze that have left nurses and patients in jeopardy on a daily basis. I will now turn the podium over to State Representative Denise Garlick, who is an RN herself and who has lived through this issue as a critical care nurse and as an advocate for nurses when she served as the president of the Massachusetts Nurses Association.
As a registered nurse, it is my honor to stand here with the direct care nurses of the Mass Nurses Association, whose advocacy for their patients goes all the way from the bedside to Beacon Hill. Their courage and tenacity to prohibit mandatory overtime will ensure safe care for their patients. I also stand here on behalf of my many colleagues in the House of Representatives who support the historic bill and act improving the quality of health care and reducing costs through increased transparency, efficiency, and innovation, and who passed it with an overwhelming vote of 132 to 20 by the full legislature, and the governor signed, and they support prohibiting mandatory overtime. First and foremost, I wish to thank the Speaker for his commitment to the accessible, affordable, quality health care for the people of our Commonwealth by assembling an extraordinary team to deal with the complicated issue of health care. This work was extensive and involved the economy of Massachusetts families and seniors, our municipalities, committed and powerful stakeholders, both patient and industry advocates, and Chairman Walsh was the outstanding leader of this team. He is a wise negotiator and has been a consistent, strong advocate for patients. The committee and staff's work was strongly supported by Leader Mariano and Chairman Dempsey. And in addition, I want to thank Representative Jim O'Day, the lead sponsor of this legislation for many, many years. Rep. O'Day has been a tenacious leader on behalf of all nurses and their patients in the Commonwealth. And finally, sincere thanks to Senate President Therese Murray, our colleagues in the Senate, for their leadership and commitment to this critical issue. I want to discuss with you the importance of the prohibition of mandatory overtime and why there is a critical need in this healthcare cost containment bill. Briefly, I want to talk about 4 elements. First, what is mandatory overtime? Second, why is it a problem? Third, how does this new law solve our problem? And fourth, what are our future steps? So first and foremost, what is mandatory overtime? We all think that we know what that concept is. The definition is, quote, any hours worked by a nurse in a hospital setting to deliver patient care beyond the predetermined and regularly scheduled hours for that hospital and the nurse have agreed on that the employee will work, provided that in no case shall such predetermined and regularly scheduled number of hours exceed 12 hours in any given 24-hour period. On the schedule, the nurse has an assigned amount of time, whether that is 8 hours, 10 hours, or 12 hours. That's the mutually agreed upon agreement. Anything that exceeds that, that's on the schedule, then becomes overtime. This requirement, this very definition of mandatory overtime, is in keeping with the recommendations of the Institute of Medicine. Today, a nurse's shift is a marathon. Patients enter the hospital sicker, their acute needs are greater, and they leave often needing very complex discharge planning that is done by their nurse. Mandatory overtime is when the nurse finishes his or her regularly scheduled shift, and regardless of their capacity to continue, they are told, why don't you run that marathon again and do it now? So what's the problem? I was at a nursing conference several years ago when I heard Dr. Lucian Leap, one of the nation's leading experts on patient safety, decry the healthcare industry's use of mandatory overtime as a staffing mechanism. And this is a quote from Dr. Leap. "Healthcare is the only profession on the planet that does not believe that fatigue degrades performance." I will tell you, as a nurse who worked in a major teaching hospital caring for severely critically ill patients, I will tell you that fatigue does indeed impact the safety of care the patient receives. I will tell you, as a nurse who worked in other settings with people who had mental health problems, with disabled adults, that fatigue does indeed impact the safety of care that patients receive. And I will tell you, as a family member, that when my mother was dying, I know that fatigue impacted and degraded the nurse's performance. As a legislator, I can tell you that it's unacceptable that any hospital or nursing administrator would think about putting patients in this position, yet they have and they do it every day in our state, and it must not be allowed. The law is the solution. We know our problem now. The law is the solution. What does the law do? The law prohibits nurses from working mandatory overtime except in the case, and this is a quote from the law, an emergency situation where the safety of the patient requires its use and where there is no reasonable alternative. So the crux of all this is then, what is an emergency situation? The emergency situation will be defined by the newly established Health Policy Commission that will conduct a public hearing and consult many stakeholders, including nurses, to determine what constitutes an emergency situation. However, it is my unequivocal position that once a nurse's shift ends, whether it is 8, 10, or 12 hours, she or he cannot be required to work mandatory overtime, with the only exception being for a county, state, or nationally declared emergency, such as what we just experienced with Hurricane Sandy. But day-to-day operations of a hospital do not correlate to the requirements for responding to a once-in-a-century storm. The law requires that hospitals report all instances of mandatory overtime to the Massachusetts Department of Public Health, and that these reports will be made available to the public. And the law protects nurses by prohibiting any discrimination, dismissal, discharge, or any other employment decision based on the nurse's refusal to accept work in excess of the limitations on mandatory overtime. The law also prohibits mandatory overtime being used as an alternative to providing appropriate staffing for the level of patient care required. This means that hospitals will no longer be able to do what they have done for years, which is to post schedules that have numerous holes built into the schedule. Nurses talk about this like we think everyone knows what this means. What this means is today is November 1st. The schedule will go up for the month of November. The time needed to care for patients adequately is split into shifts on that schedule. And today, some hospital administrator or nursing director knows that on November 17th, we don't have enough nurses to work. And that hole is left in that schedule, and the plan, unspoken, is that it will be filled with mandatory overtime. This is totally inappropriate. It is either management incompetence or negligence, because it is the hospital's responsibility to have enough nurses to cover the shifts needed to provide the care. There is no shortage of nurses. There is only a shortage of employers willing to hire the needed nurses to provide for safe care. You need not take my word for that. You only need to go back to your hometown and see the number of talented, qualified, educated nurses who have passed their boards who cannot get a job in our hospitals in the Commonwealth today. And it is certainly not the nurse's responsibility to run that second marathon and work while fatigued and endanger the patients simply because our hospitals don't want to hire the staff needed to operate safely. The same applies for increases in census or sick calls by nurses. These are not justifications for declaring an emergency. They are the expected consequences of running a hospital. They are the very reason good managers plan for contingencies. When Hurricane Sandy hit, nurses worked long and hard to keep their community safe in Massachusetts and in our neighboring states. But day-to-day operations of a hospital do not correlate to the requirements for responding to a once-in-a-century storm. So why now? We, as nurses in this Commonwealth, have worked for years on this legislation. Why now is it so imperative that it is in the healthcare cost containment bill and will be enacted November 5th? While the legislature was working hard to craft payment reform legislation that held down costs in healthcare, the inclusion of the mandatory overtime ban was a crucial component because we did not want hospitals to use the pressure of payment reform as an excuse to cut care at the bedside. And while hospitals are indeed, even as I speak, using the discussion of payment reform on the state and national level as an excuse to cut patient access to nursing care, this ban in our Commonwealth on mandatory overtime, we hope will put a brake on some of that activity. The prohibition of mandatory overtime moving forward becomes effective on November 5th. As legislators, we understand that this law represents a significant change in how hospitals conduct their operations. But as a matter of public safety, we expect hospitals to comply with this law. I have spoken with the M&A and other patient advocates, and many have taken steps to post information on their websites about the law, and they will be gathering reports from nurses on the front line about how hospitals are responding. And I will seek that information and will be sure to share it with my colleagues in the legislature, my colleagues on the Joint Committee on Public Health, my colleagues on the Joint Committee on Healthcare Financing, DPH, and other agencies responsible for enforcing this law. This legislature, of which I am so proud to belong, understands that the provision of nursing care is central to the delivery of quality patient care, and that according to research, it is also central to the provision of cost-effective and, yes, cost-saving care. So once again, I applaud these nurses, my colleagues. These nurses are true leaders of their profession, and I am proud of my legislative colleagues for the steps that we have taken to protect the cost and quality of care patients and their loved ones receive in our Commonwealth. Thank you.
As you have heard from all of our speakers, a major concern of our organization beginning on Monday will be to ensure that the industry is complying with the law. We have already heard reports from both union and non-union facilities, and we have seen opinions offered by anti-union law firms that work for these hospitals, which indicate that some employers are planning on finding ways to skirt or avoid compliance with the law. In anticipation of this, we have already done one mailing to all the nurses in the state about the law, informing them of their rights. We have also set up a page on our website which contains an online form for nurses to report any instances where they have been mandated to work overtime. We will be gathering that data and sharing it with the Department of Public Health, the legislature's Public Health Committee, and other responsible agencies to ensure that the industry is held accountable for following this law.